Exploring sexuality is a natural and healthy part of growing up. To enable adolescents to do this safely and with mutual consent, they need access to comprehensive sexual and reproductive health information and services. For example, research shows that comprehensive sex ed can enhance gender equality within relationships and empower adolescents to avoid unwanted pregnancy. And international human rights bodies and public health authorities agree that access to contraception and safe abortion care are essential to adolescent health and rights. But adolescents need more than information and services to navigate this transition into adulthood. Laws and policies must also support adolescents' right to make informed decisions about their sexual and reproductive health. Yet, a number of countries across the globe still have laws preventing adolescents from accessing sexual and reproductive health services. Some countries even have laws that criminalize consensual sexual conduct between close in age adolescents. These laws can lead to the arrest and imprisonment of teenagers engaged in healthy, consensual sexual activity. The UN Committee on the Rights of the Child recognizes that countries should not criminalize adolescents for engaging in consensual and non-exploitative sexual conduct. Next, we'll hear from experts in Kenya and Uruguay about how laws and policies in these countries are impacting adolescents' sexual and reproductive health and rights.
Kenya has laws and policies that acknowledge the need to ensure adolescent access to youth-friendly, youth-responsive services and information on their sexual and reproductive health and rights. We have, for example, the Constitution of Kenya 2010, which enshrines the right to health, including reproductive health for everyone, including adolescents. Then we also have the Children's Act, which was recently passed, and the Children's Act also acknowledges the need for adolescents to be able to access services and information on sexual and reproductive health. Despite acknowledgement in the country that adolescents have a right to access information and education and services on sexual and reproductive health, the full realization of adolescent sexual and reproductive health and rights is hampered by several factors. In Kenya, one of the factors that hampers full adolescent sexual and reproductive health and rights is the Sexual Offences Act. The Sexual Offences Act is a law that was intended really to protect children from violations of sexual nature. Instead, the Sexual Offences Act criminalizes all sexual conduct between persons who are under 18 without any exceptions. What this means is that non-coercive, non-exploitative sexual conduct between adolescents is criminalized. The effect of this criminalization is that adolescents are afraid to go seek services and information on their sexual and reproductive health, even when they're engaging in sexual conduct, because they see themselves as being in a position where if they went to seek services and information, they'd be exposing themselves to the consequences of this criminal law. The other effect of this law is that health service providers do not necessarily always want to provide information to adolescents who come to them to seek services and information because they have communicated that they see themselves as aiding a criminality, and therefore they feel that by providing the services and information to adolescents, then they would be exposing themselves to the consequences of implementation of this criminal law. Another real consequence of implementation of the Sexual Offences Act as it is currently framed, the arrests, the detention, the prosecution, and the imprisonment of adolescents for non-coercive, non-exploitative, consensual sexual conduct. So the disconnect that we see between the Sexual Offences Act as it's framed and implemented with the laws and policies that we see in this country, such as the Constitution and the Children Act, that are supposed to give effect to adolescent access to sexual and reproductive health and rights, also pose a huge dilemma for the government. The Ministry of Health in Kenya has currently aligned itself around addressing the triple threat, which includes teenage pregnancies and high rates of HIV incidences. This requires adolescents who are involved in consensual sexual conduct to present themselves to facilities to be able to seek services and information on their sexual and reproductive health and rights. However, with the law as it's existing now, and the threat that it poses to these adolescents being arrested, being detained, being imprisoned, the government is almost working at cross purposes with itself.
Thank you, Betty. Next, we'll hear about how Uruguay has approached this issue.
Uruguay stands out in Latin America and the Caribbean for its exemplary commitment to ensuring sexual and reproductive health and rights for adolescents and young people. This transformative journey began in 2008 when the state officially recognized these rights as fundamental human rights. Subsequently, Uruguay integrated universal sexual and reproductive health services into its national health system, introducing unrestricted access to contraceptive methods. A groundbreaking move occurred in 2013 as Uruguay embraced the implementation of legal abortion services. Notably, adolescents aged 15 and above in Uruguay have the right to these confidential sexual and reproductive health services without requiring parental authorization or consent. The age of sexual consent is set 15 according to the criminal code. The code establishes that consensual relations between peers over the age of 13 are exempted from this sanction, as long as there is no difference of more than 8 years and no violence or intimidation has been committed. The legal landscape in Uruguay addresses sexual offenses, particularly those involving adolescent victims, established in the penal code and reinforced by law of sexual violence against children, adolescents, and disabled persons in 2004, and by law on gender-based violence in 2017. The legal framework aligns seamlessly with international conventions and recommendations on adolescents' rights and sexual and reproductive health. The country commitment has yielded tangible results. This is visible, for example, through a remarkable decrease in the adolescent fertility rate from 60 per 1,000 to 28 per 1,000 in less than 5 years, between 2016 to 2021. However, recent times have brought about a shift in focus due to the rise in sexual crimes against children and adolescents. This harsh reality underscores a persistent challenge. Despite progressive norms on paper, ensuring genuine access to adolescent sexual and reproductive rights remains a formidable task.
These two examples illustrate that laws criminalizing consensual sexual activity do not protect adolescents from violence. Instead, they lead to adolescents being arrested and imprisoned for healthy sexual behavior and prevent teens from accessing sexual and reproductive health services. In low and middle income countries, nearly half of all sexually active adolescent girls do not have access to modern methods of contraception. 12 million adolescents give birth each year, and 27,000 girls aged 15 to 19 die during pregnancy and childbirth. The need for action is clear. Adolescents must be able to access sexual and reproductive health information and services. Countries across the globe must also decriminalize consensual sexual conduct among close-in-age adolescents. Guaranteeing adolescents the right to make informed decisions about their sexual and reproductive health is a human rights and public health imperative.